that's something that you have to deal with. If you hear rows and bronchi and all that stuff, I admire you. It really doesn't guide what we're doing for treatment. I don't believe for high-risk patient encounters that a blood pressure offers you any more than a palpable pulse. So it's like a trauma patient, you with me? And getting a blood pressure cuff in her line of cough may be a good way for us to go through blood pressure cuffs too quickly. If I have a palpable pulse and a rate of 80, that's good documentation on vital signs for a high-risk patient. If it's a trauma that's not too bad, or the MI patient or something, please get the blood pressure. Does everybody understand the distinction there? I don't want you to get anything more dirty than we have to get dirty for our routine patient encounters with high-risk patients. And what you need is a stethoscope and a pulse oximeter. Okay? And then those go to an area where they will be cleaned. What cleans the COVID virus? Anything. Anything kills it. Bleach, chlorine, alcohol, soap and water, anything cleans it, so we don't have to get really fancy. And then the next thing, kick me the stretcher over, let's get you on the stretcher. If the pulse oximeter is low and she needs oxygen, how do I deliver it?
Low what?
Nasal cannula under the mask. Could I ask you, you need a little oxygen, it'll make you feel better. I'm gonna ask you to pull down your mask just for a second. Please don't cough on me as you do that. If you'll pull that down, I'll put the cannula on, we'll ramp it up. If I still have the pulse ox on, we'll check and make sure that with O2 treatment. And you understand that would kind of like being put a plastic mask on her face, which is not good for this because it's likely to make her cough and she's gonna rip it off and cough at you. Understand that? All right, if somebody's in distress, CPAP is going to be an ongoing problem. That certainly will generate aerosols and stuff that go at you. So that's another high risk time for you to shut down up completely. Okay. All right, so that's care. Now we have to go into the medic unit. How do we prepare the medic unit?
Nothing needs to be out, loose.
Nothing needs to be out. You're gonna have to clean up all horizontal surfaces on the medic unit after patient care, all horizontal surfaces, so get everything out of your way. Who gets to go in the front seat on the passenger side?
Nobody.
Nobody. So I think soon we'll be locking down, and I'm afraid for you guys, you're gonna be locking the stations down and not doing any public education stuff. But the front seat and the medic should be empty. And the only time I'm hoping that we'll have to transport somebody else is the parent with the child. Okay? And I know that that's not comfortable, it's not a conversation you like to have, to tell family members. A lot of people here have transportation problems, and we're not gonna put them in the battalion cars, unless we have to, but you should anticipate if this one is sick, the family members are sick, and don't put them in the front of the medic unit. And they're not gonna be welcome at the hospital anyway, because they're locking down all the hospitals now for visitors too. Okay? But they go in the medic unit. You've cleaned the medic unit of extra stuff. Either put it in the engine or put it in the front compartment. Driver stays safe and away so that we don't have two people exposed unless it's absolutely necessary. Notify the hospital. It is possible in the next couple weeks there will be special entrance systems at the hospitals or tents outside. It is possible in the next couple weeks that they will designate hospitals. That has not been done yet, and any hospital right now is supposed to be ready for it. Cleanup. What's the most important cleanup?
Horizontal surfaces.
No, what's the most important cleanup? Before we get to horizontal surfaces.
Hands.
Me! Number one, make me clean. Okay, so all the right things. If you're gonna take your mask off and reuse it, clean hands first before you do that, so that you're not doing this as you take your mask off and then have a contaminated mask that you want to put back on again. All right, so it's taking your appropriate stuff off, throwing it away, clean the stethoscope, clean the pulse oximeter, clean the medic unit. Horizontal surfaces is a good start. If you knew that she coughed on the cabinets and over the sink without her mask on, then you go, I gotta have to clean that up too. But this bug has a tendency to settle quickly and to be cleaned and killed by anything. And then please make sure I'm clean before I get back in the medic, and before the medic gets back to the station, or the same with the engines.
7 regional, non-emergent, 1 station, 2 riders, starting mileage 34.1.
3:57, I'm gonna have to stop. Did I miss anything that anybody wants to go through quick? Not something to be afraid of, we'll respect it. We've been through all the other, stuff with you guys. I've been through anthrax, SARS, Ebola was liquid cyanide. It was liquid death. That was one to be respected if it happened. And that's where we cocooned people, because everything liquid, and that liquid could stay, blood, poop, puke, etc. So that was a different one. You guys were used to it because I could say liquid cyanide and you know how to deal with it. This is a respiratory virus, and it wants to spread directly human to human. And it doesn't sit in the surfaces. It's not anthrax spores sitting in the building, nothing like that. Okay. Anything else?
That the adults are getting through it just fine?
Yes.
And, is it something you can get reinfected with?
No.
Okay.
There may be a different version of it, but just like everything else, and many of you have been through your childhood diseases, and here you are an adult and still don't get them. Okay. Chicken pox is the weird one. Shingles later. Anything else? All right, I am staying in touch. Your chief's very interested, your city's very interested. If anything new comes about, you guys get it first. Major gave me yesterday a really nice gift, and I wanted to wear it in. You guys gave me a jacket, and I'm very grateful. And I want you to know how grateful I am working with this department. You teach me every time I come here a little bit of something good. And it's been 18 years, and I'm very grateful.